waking up one morning and forgetting why you walked into the kitchen. You shrug it off and tell yourself, I'm just getting older. A few days later, you can't remember where you left your glasses. Then you forget the name of someone you've known for years. Soon, simple conversations become harder to follow, and your family starts asking if everything is okay. Naturally, your mind jumps to one frightening possibility: dementia. But what if some of those symptoms aren't caused by dementia at all? What if a medication you've been taking for months or even years is contributing to confusion, drowsiness, or memory problems? This isn't about creating fear. It's about giving you information that could help you have a more informed conversation with your healthcare provider. As we age, our bodies change in ways that affect how medications work. Medicines that were well tolerated in our 40s or 50s may have stronger effects after 60. The liver and kidneys often process drugs more slowly, body composition changes, and the brain can become more sensitive to certain medications. Even when each medicine is appropriate on its own, taking several together can increase the risk of side effects. Today, we're going to discuss 9 types of medications that doctors often review carefully in older adults because they can sometimes affect memory, attention, or clear thinking. That does not mean everyone who takes these medications will experience these problems, and it certainly does not mean you should stop taking any prescribed medication on your own. Instead, think of this video as a guide to help you ask better questions and become an active partner in your healthcare. By the end of this video, you'll also learn simple habits that may help protect your brain health and reduce medication-related risks. If you care about keeping your mind as sharp as possible as you age, stay with us until the end. Some of the most surprising medications. Ever walked into a room and suddenly forgotten why you were there? Maybe you misplaced your car keys for the 3rd time this week. Perhaps you struggled to remember the name of a neighbor you've known for years. Or maybe you found yourself reading the same paragraph over and over because it simply wouldn't stick. If you're over the age of 60, experiences like these can be unsettling. For many people, the first thought is this the beginning of dementia? It's a frightening question, and one that millions of older adults quietly ask themselves every day. But here's something that often gets overlooked. Not every memory problem is caused by dementia. In fact, there are many reasons why someone may experience forgetfulness, confusion, or difficulty concentrating. Poor sleep, dehydration, stress, vitamin deficiencies, infections, untreated hearing loss, depression, and even medication side effects can all affect how the brain functions. That's why today's discussion is so important. We're not here to create fear or tell you that medications are dangerous. Quite the opposite. Modern medicine has helped people live longer, healthier lives than ever before. Medications control blood pressure, reduce the risk of heart attacks and strokes, relieve chronic pain, manage diabetes, improve mental health, and treat countless other conditions. Many of these medications are life-saving. The goal isn't to stop taking them. The goal is to understand that as we grow older, our bodies change. Those changes can affect the way medications work. Think of your body as a car. When it's brand new, every system runs efficiently. The engine responds quickly, the brakes are sharp, and everything works together smoothly. Years past, that same car still performs well, but it requires different care. Oil changes become more important. Tires wear down. Certain parts need closer attention. The same is true for the human body. A medication that worked perfectly 20 years ago may affect you differently today, not because the medicine changed, but because your body did. One of the biggest changes occurs in the kidneys. Your kidneys act as your body's natural filtration system. They remove waste products and help clear many medications from your bloodstream. As people age, kidney function often declines gradually. This is a normal part of aging for many individuals. When the kidneys work more slowly, some medications remain in the body longer than expected. Instead of leaving your system efficiently, they may build up, increasing the chance of side effects such as excessive drowsiness, dizziness, or confusion. The liver also plays a major role. Many medications are processed by the liver before they leave the body. As liver function changes with age, certain medicines may stay active for longer periods. This means the same dose you've taken for years could have a stronger effect than it once did. Another important change involves body composition. Most adults lose muscle mass as they age while body fat tends to increase. Some medications are stored in fat tissue, allowing them to remain in the body for longer than they otherwise would. Again, this doesn't automatically make the medication unsafe. It simply means that the dose or choice of medication may need to be reviewed from time to time. Perhaps the most important change occurs in the brain itself. The aging brain can become more sensitive to medications that affect the central nervous system. Drugs that cause only mild drowsiness in younger adults may produce significant sleepiness, slowed thinking, or temporary confusion in older adults. You've become quieter. They may notice you're repeating stories more often. Perhaps you've become less interested in activities you once enjoyed because you feel tired or mentally foggy. These changes can be subtle, and because they develop slowly, many people simply assume they're an unavoidable part of aging. Fortunately, that's not always true. In some cases, a healthcare professional can identify medications that may be contributing to these symptoms and determine whether adjustments are appropriate. Another concept that's especially important after 60 is something called polypharmacy. It's a medical term that simply means taking multiple medications at the same time. Many older adults take medicines for blood pressure, cholesterol, diabetes, arthritis, osteoporosis, heart disease, acid reflux, allergies, sleep problems, or chronic pain. Each medication may have been prescribed for a good reason. But when several medications are combined, the overall effect on the body can become more complicated. Some medications increase the effects of others. Some may slow the body's ability to process another medicine. Others may increase drowsiness when taken together. Even over-the-counter medications, herbal supplements, and sleep aids can contribute to these interactions. That's one reason healthcare providers often ask patients to bring all of their medications, including vitamins and supplements, to appointments. A complete medication review can reveal combinations that deserve closer attention. Another common misconception is that if a medication is available without a prescription, it must be completely harmless. Unfortunately, that's not always the case. Medicines can cause side effects that are especially noticeable in older adults. That's why it's important to tell your healthcare provider about everything you take, not just prescription medications. Now let's talk about memory itself. Our brains naturally change as we age. Processing information may become slightly slower. Learning new technology might take more patience than it once did. Occasionally forgetting where you left your glasses or needing extra time to remember a name can be part of normal aging. But there are situations where memory changes deserve medical attention. For example, repeatedly getting lost in familiar places, forgetting close family members, becoming confused about the date or location, struggling to follow simple conversations, or experiencing sudden changes in thinking should never be ignored. These symptoms require prompt evaluation because they may have many possible causes. Some causes are progressive neurological diseases. Others may be treatable medical conditions. Still others may relate to medication effects or interactions. That's why self-diagnosis can be risky. Instead of assuming the worst or ignoring the problem entirely, it's better to seek professional evaluation. One of the most encouraging aspects of medicine today is that healthcare providers have many tools to help identify potential medication-related problems. Sometimes a simple dosage adjustment makes a significant difference. Sometimes changing the timing of a medication helps. Situations, a different medication with fewer side effects may be available. These decisions should always be made with the guidance of a qualified healthcare professional. It's also important to understand that stopping certain medications abruptly can be dangerous. Some medications require gradual dose reductions. Others protect against serious conditions such as seizures, heart problems, or severe anxiety. Never discontinue a prescribed medication without first discussing it with the healthcare professional who manages your care. Knowledge is powerful, but it must be paired with good medical advice. As we continue through this video, you'll learn about several categories of medications that doctors often review carefully in older adults because they may contribute to temporary confusion, drowsiness, or memory difficulties in some people. Remember, this does not mean these medications are bad. It does not mean they should never be used. And it certainly does not mean everyone taking them will experience memory problems. Every person's health is unique. The purpose of this information is not to replace your doctor. It's to help you become a more informed patient. When patients understand their medications, they can ask better questions. When they ask better questions, healthcare providers can make better informed decisions together with them. That partnership is one of the most effective ways to protect both your overall health and your brain health. So as we move into the first medication category, keep an open mind. You may discover that one small conversation with your doctor or pharmacist could make a meaningful difference in how you feel each day. The most commonly used medication categories among older adult sleep medications and why doctors monitor them carefully in people over the age of 60. For millions of people over the age of 60, a good night's sleep can feel almost impossible to achieve. Maybe you lie awake for hours, unable to quiet your mind. Perhaps you wake up several times during the night and struggle to fall back asleep. Or maybe you wake long before sunrise, feeling exhausted before the day has even begun. Sleep problems become more common with age. Changes in our body's internal clock, chronic pain, nighttime bathroom trips, stress, certain medical conditions, and even some medications can all interfere with healthy sleep. When sleepless nights become a regular part of life, many people understandably look for a quick solution. That's where sleep medications often enter the picture. For some people, these medications can be very helpful. They may provide short-term relief during periods of acute insomnia, after a stressful life event, or while another medical condition is being treated. Used appropriately and under medical supervision, sleep medications can play an important role in improving quality of life. But here's what many people don't realize. As we grow older, the same medication that once helped us sleep through the night may begin affecting us differently the next day. This doesn't happen to everyone. However, older adults are generally more sensitive to the effects of medications that slow activity in the brain. Healthcare professionals pay close attention to this because the goal isn't just to help someone sleep, it is also to help them wake up alert, steady, and mentally clear. Imagine this scenario. Margaret is 68 years old. Several years ago, after the loss of her husband, she began having difficulty sleeping. Her doctor prescribed a sleep medication to help during that difficult period. Sleep faster. She stayed asleep longer. She finally felt rested. Over time, however, she began noticing something unusual. She felt groggy most mornings. She needed extra coffee just to get going. She occasionally forgot where she placed everyday items. Sometimes she repeated questions she had already asked. Her family started wondering whether these were early signs of dementia. Concerned, Margaret scheduled an appointment with her physician. After reviewing her medications, her doctor recognized that the sleeping pill could be contributing to her daytime symptoms. Together, they discussed safer strategies for managing her insomnia and gradually adjusted her treatment plan. Over the following weeks, Margaret noticed she felt more alert during the day. Her memory improved and she regained confidence in her daily activities. Stories like this illustrate an important point. Not every memory concern is caused by a progressive brain disease. Sometimes medication effects deserve careful consideration. So why can sleep medications affect older adults differently? One reason is that many prescription sleep medicines work by slowing activity in the central nervous system. This calming effect helps people fall asleep, but in some individuals, especially older adult, effects may last longer than intended. As we discussed earlier, aging can slow the body's ability to process and eliminate certain medications. If a medicine remains in the body longer, its effects may continue into the next morning. Instead of waking refreshed, a person may experience what some describe as a sleep hangover. They may feel unusually tired, mentally sluggish, or slower to react. Concentration may be more difficult. Short-term memory may seem less reliable. Simple decisions may take longer than usual. It's important to understand that these symptoms can have many causes. Poor sleep itself can also reduce concentration and memory. That's why it's essential not to assume that medication is the only explanation. Healthcare professionals consider the complete picture, including medical history, sleep quality, other medications, and underlying health conditions. Another concern is balance. Many sleep medications can increase drowsiness during the night. Imagine waking at 2 o'clock in the morning to use the bathroom. If you're still under the influence of a sedative, your balance and reaction time may be impaired. A simple trip down the hallway becomes more dangerous. Falls are one of the leading causes of injury in older adults. A hip fracture or head injury can have life-changing consequences, sometimes resulting in lengthy hospital stays, rehabilitation, or loss of independence. This is one reason many healthcare organizations encourage clinicians to prescribe these medications cautiously in older adults and to use the lowest effective dose for the shortest, appropriate time whenever possible. Another issue is that some people begin relying on sleeping pills every night for months or even years. While some individuals may need long-term treatment under close medical supervision, others may benefit from periodically reviewing whether the medication is still necessary. Sleep patterns often change over time. Medical conditions improve. Stressful situations resolve. Treatment goals evolve. Regular medication reviews help ensure that each prescription continues to provide more benefit than risk. Let's also address a common myth. Many people believe that if they have trouble sleeping, taking a larger dose will simply help them sleep better. In reality, taking more than the prescribed amount can increase the risk of excessive sedation, confusion, falls, and other serious side effects. Always take medications exactly as directed and never adjust the dose without consulting the prescribing healthcare professional. Another misconception is that over-the-counter sleep aids are automatically safer because they don't require a prescription. Some non-prescription sleep products contain ingredients that can also cause drowsiness, confusion, dry mouth, blurred vision, or difficulty urinating in older adults. That's why it's important to tell your doctor or pharmacist about every product you use, including vitamins, herbal supplements, and over-the-counter medications. Many people are surprised to learn that pharmacists are excellent resources for medication questions. They can help identify possible interactions, explain side effects, and recommend when to speak with your physician. If you currently take a sleep medication, don't panic after hearing this information. Remember, many people use these medicines safely and appropriately. Instead of worrying, ask yourself a few simple questions. Do I often feel unusually sleepy during the day? Have I become more forgetful since starting this medication? Have I experienced dizziness or falls? Do family members say I seem more confused than usual? Am I taking other medications that also cause drowsiness? If the answer to any of these questions is yes, it doesn't necessarily mean your medication is responsible. It simply means the issue deserves a conversation with your healthcare provider. Your doctor may recommend additional testing, review your medication list, adjust the timing of your dose, suggest lifestyle changes, or determine that another treatment would better meet your needs. Thus, something encouraging. Many cases of insomnia can improve with healthy sleep habits, sometimes called sleep hygiene. While these strategies don't work overnight, they can make a meaningful difference over time. Try going to bed and waking up at the same time each day, even on weekends. Limit caffeine later in the afternoon and evening. Reduce alcohol close to bedtime, as it can disrupt sleep quality even if it initially makes you feel sleepy. Keep your bedroom cool, dark, and quiet. Avoid bright screens from phones, tablets, or televisions during the hour before bed. Regular daytime physical activity can also promote better sleep, though vigorous exercise should generally be avoided right before bedtime. If worries keep your mind racing at night, consider relaxation techniques such as deep breathing, gentle stretching, meditation, or writing tomorrow's tasks on paper before bed. For some people, cognitive behavioral therapy for insomnia, often called CBTI, has been shown to be an effective treatment without relying solely on medication. A healthcare professional can help determine whether this approach may be appropriate. The most important message to remember is this: sleep is essential for brain health. Treating insomnia matters, but the treatment should help you not only sleep well that night, but also think clearly, stay balanced, and enjoy your daytime life. The best treatment plan is one that is personalized to your health, regularly reviewed, and adjusted when necessary. As we continue through this video, you'll discover that sleep medications are only one category doctors evaluate when someone over 60 develops new memory concerns. Next, we'll explore another commonly prescribed group of medications that healthcare providers monitor carefully because they can sometimes affect alertness, balance, and memory in older adults.